Borderline personality disorder, or BPD, is one of the most misunderstood and stigmatized mental health conditions. Often portrayed unfairly in media or whispered about in therapy offices, it carries a weight that many people don't fully understand. But beneath the label is a deeply human experience, one rooted in pain, fear, longing, and survival. BPD is not a moral failing, a personality flaw, or a sign of being crazy. It's a complex psychological condition shaped by early life experiences, trauma, emotional sensitivity, and neurobiological differences. And for those living with it, the struggle is not about being manipulative or dramatic. It's about coping with a world that feels overwhelming, inconsistent, and unsafe. If you or someone you love has ever felt lost in this emotional storm, you're not alone. We explore the real stories, struggles, and healing paths of mental health right here on The Code Purple Project. Subscribe now for more compassionate, honest content that tells the truth behind the diagnosis. At its core, borderline personality disorder is a condition that affects the way a person experiences emotions, relationships, and self-identity. People with BPD often feel emotions more intensely and for longer periods than others. What might be a mild irritation for someone else can feel like devastation for someone with BPD. They don't choose to react this way. It's how their brain processes emotional input. The emotional dial isn't just turned up, it's broken. And when you feel everything so deeply, it makes navigating life a daily challenge. One of the hallmark symptoms of BPD is a fear of abandonment. This isn't just anxiety, it's a deep, visceral fear that those they care about will leave, reject, or stop loving them, often without warning. This fear can be so powerful that it triggers frantic efforts to keep someone close, which can sometimes look like neediness or manipulation from the outside. But underneath those behaviors is a terrified inner child, begging not to be left alone. Many people with BPD have experienced inconsistent caregiving, trauma, or neglect in early childhood, where love felt conditional or unpredictable. These early experiences lay the groundwork for intense attachment patterns that carry into adulthood. Another key struggle for those with BPD is a fragile sense of self. They may not feel like they truly know who they are. Their identity can shift, depending on who they're with, what they're doing, or how they feel in the moment. One day they might feel confident and purposeful, the next worthless and invisible. This unstable self-image contributes to impulsivity, changing goals, and difficulty making long-term decisions. It's not that they're being flaky, it's that their internal compass is always shifting. Relationships are often intense and unstable for people with BPD. They may idealize someone one moment and devalue them the next. This isn't manipulation, it's emotional whiplash. When someone feels afraid of being hurt or abandoned, their brain flips quickly between clinging and pushing away. They may test people, sabotage relationships, or lash out, not because they want to, but because they don't know how to regulate the tidal wave of fear and sadness inside. The pain of feeling misunderstood or rejected, even over something small, can feel catastrophic. BPD also brings a tendency toward impulsive and self-destructive behaviors, substance use, reckless driving, binge eating, or self-harm. These behaviors are not just acting out. They are often attempts to numb unbearable emotional pain or to feel something, anything, when numbness takes over. For many, self-harm becomes a physical expression of inner chaos. It's not attention-seeking. It's a desperate way to survive. And for those on the outside looking in, it's important to respond with compassion, not judgment. Mood swings are another part of BPD that can confuse others. Someone can go from euphoric to enraged to despondent in the span of a few hours. These shifts aren't random. They're often triggered by interpersonal stress or internal fears. Unlike bipolar disorder, which has longer mood cycles, BPD emotional shifts are rapid and reactive. That makes emotional regulation extremely difficult. The person may recognize their reactions are disproportionate, but still feel powerless to stop them. Another painful aspect of BPD is chronic emptiness. Many people with BPD describe a hollow, aching void inside that nothing seems to fill. Even when things are going well externally, they may still feel disconnected, numb, or unworthy. This emptiness can drive the search for external validation, new relationships, or intense experiences, only to find that the relief is always temporary. The root problem isn't solved by more stimulation. It's soothed through deep healing and self-connection, which often takes time and guidance. Dissociation can also occur, moments when the person feels detached from their body, emotions, or reality. It's a coping mechanism developed during times of extreme emotional distress or trauma. Dissociation can be terrifying and disorienting, and it often adds to the feeling of not being real or not belonging. Again, this isn't a choice, it's a nervous system's survival strategy. Despite all these challenges, people with BPD are not hopeless. In fact, one of the most beautiful truths about BPD is that recovery is absolutely possible. Unlike some mental illnesses that are chronic and degenerative, BPD often improves significantly with the right treatment. Many people with BPD go on to have fulfilling careers, relationships, and lives. The path to healing is not easy, but it is real, and it begins with understanding. Dialectical behavior therapy, or DBT, is one of the most effective treatments for BPD. Developed by Dr. Marcia Linehan, who herself has lived experience with BPD, DBT teaches skills in mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. It doesn't just talk about the past, it provides tools to manage the now. DBT has helped countless people learn how to pause before reacting, how to soothe intense emotions, and how to build healthier relationships. Therapy is powerful, but so is community. People with BPD often carry immense shame. They've been called too much, too sensitive, too unstable. But in reality, many of them are incredibly empathetic, creative, passionate, and loyal. When they learn to manage their emotions and build a stable sense of self, those same traits become superpowers. What was once seen as weakness becomes strength. The key is reducing stigma so people can seek help without fear. Unfortunately, stigma still surrounds BPD, even among mental health professionals. Some clinicians refuse to work with BPD clients, citing them as too difficult or too dramatic. This kind of rejection only reinforces the wounds BPD already creates. That's why awareness matters, education matters. When we understand the why behind the behavior, we stop blaming and start helping. We stop fearing and start connecting. People with BPD don't need to be fixed. They need to be seen, heard, and supported. If you love someone with BPD, your support can make a huge difference. It's not your job to save them, but your understanding, boundaries, and patience matter. Learn about the condition. Listen without trying to fix. Offer compassion even when it's hard. And take care of yourself too. Loving someone with BPD can be intense, but it can also be incredibly meaningful. Relationships grounded in truth and empathy can help both people grow. If you live with BPD yourself, know this: you are not bad, broken, or beyond help. You are living with a condition that makes the world more intense, but also more vivid. You are capable of healing, of building stability, of experiencing love and peace. It won't happen overnight, but it is possible. You deserve a life that feels safe and worth living. And no matter what anyone has told you, you are not too much. You are enough. Let's rewrite the story of BPD from one of shame and fear to one of hope, resilience, and recovery. Let's replace judgment with empathy, labels with listening. Healing begins when we stop hiding. If this message speaks to you or someone you care about, you don't have to navigate this alone. Subscribe to the Code Purple Project for more real talk, resources, and stories from the heart of mental health.